So see what we call as uh, uh, short form as caution, and that if there is a change in voice, C stands for change in voice or hoarseness, and which persists over a period of time. Any lady who feels a lump in the breast or in the armpit, a painless lump generally, because in the initial stage, cancer is generally a painless disease. Association of pain with cancer signifies a late disease where the cancer is really spread out. So, a painless lump in the breast or anywhere in the body. At the same time, the caveat is that most of the lumps in the breast are going to be non cancerous. Every lump in the breast is not cancerous. But then, how would we get to know? We would only get to know if we do some tests on that, like a mammogram or a biopsy, if that is indicated. So, as I said, a change in voice, a painless lump, or a mole or a freckle on the skin, which rapidly starts growing or starts bleeding, change in the bowel habit, constipation and alternate diarrhea, passing motion with laced with blood, or any lady who's experiencing periods which are in between the two regular periods or periods which come back after achieving menopause, they could signify something sinister in the uterus. A fever which persists over a period of time and which is associated with any night sweats or with weight loss or weakness, progressive weakness, they could be signs of cancer of the immune system or of the blood system. Cough with sputum and spitting out blood over a period of time, which persists beyond a few weeks. I think these are the basic signs one has to be very cognizant of, and especially a warning, a word of caution for the smokers. Any change in the smoker's cough, hoarseness, because they are using tobacco, and tobacco is a risk factor for cancer of the voice box, which could manifest as hoarseness, is a risk factor for lung cancer, which as I said, could be manifested by cough, expectoration, and blood in the sputum. So, age vis-a-vis cancer is a very pertinent question, is a very pertinent issue. Cancer generally is a disease of aging. As our longevity goes up, as the general population lives longer, the probability of certain cancers actually rises. And this is one of the questions we are asked, that 50 years back, the incidence of cancer was not as high, or maybe 100 years back, cancer was an unknown disease because people were not living long enough. The average life expectancy was just about 40 years. Now it has climbed up to about 70 and plus. In the Western world, this is 80 plus. So as we live longer, there is a probability of getting cancers. And some of these cancers are cancer of the breast, lung, uterus, colon, and then many other cancers, which are linked to living longer, prostate cancer, living longer. And then, therefore, the screening modalities for this group of patients beyond about 50 years is actually the requirement. Say, for example, breast cancer, we generally would advocate doing a mammography after the age of 40 years, but to a certain special age group where there is a family history, strong family history of cancer, and particularly breast and ovarian cancers, or families who are carrying that bad gene, which is called as the BRCA1 and BRCA2 gene, the screening starts earlier at age 30 and beyond. Same for colon cancer. Standard is anywhere beyond the age of about 50 years, but for strong family history, the screening should start at about 40 years. For smokers and high risk individuals, there should be a low dose CT scan of the chest, and these are high risk groups that may not be actually age dependent. Anybody who's been using tobacco, and particularly smoking cigarettes or BDs 20 years and beyond are deemed high risk, and they should start screening at whatever age is applicable to them. Cervical cancer, again, is not age dependent because it is a virally transmitted disease. HPV virus, the longer it persists in the cervix, the greater the probability. Therefore, women who are sexually active should start their screening as early as possible. And that might be in their 20s as well. So there are recommendations which are age dependent, and there are recommendations which are not age dependent. They would be dependent on the family history, personal history, and many other personal lifestyle factors. Very important question again. If we look at 100 cases of cancer which are diagnosed in a clinic, straight and clear, 40% of these cancers are tobacco dependent. And there is a long list of tobacco associated cancers, and we know that cancers of the mouth cavity, voice box, food pipe, stomach, kidney, lung, uterus, urinary bladder, certain blood cancers, even now more data emerging for colorectal cancers. So the list is very long. So this is one lifestyle option which is within the reach of everyone. And imagine 40% cancers, if we don't consume tobacco, there is a probability that 40% of these cancers wouldn't happen at all. So it's a huge number. Now, coupled with use of alcohol, any amount of alcohol is bad. Alcohol actually compounds the effect of tobacco. The third is certain viral diseases, and one of the typical examples is a hepatitis B and association with liver cancers. Therefore, it should be a part of the universal, and it indeed is a part of the universal vaccination program, at least here in our country. The fourth is a viral disease, which is the HPV, and we when earlier years it used to be taught that women who have multiple sexual partners are at high risk for developing cervical cancer. That probably was because the probability of contracting the HPV infection was high, and this is also one of the preventable cancers. HPV vaccination should be a part of the universal health program. And we already know that India harbors almost about a quarter, 20 to 25% of the world burden of cervical cancer, up to about 100,000 cases per year. So this is again a preventable cancer. So and the third point is the obesity. WHO is already given an alert that 20% of the cancers are going to be on account of obesity, inactivity, poor physical activity. So, therefore, staying fit, staying active within a reasonable body frame and a body weight would give protection from cancer, and not only cancer, but many other diseases like heart, blood pressure, sugar, and so many other health issues. So this is a model which has been proven. We don't need to reinvent the wheel. And if you look at the Western world, where screening for breast cancer started as early as the 70s, very large clinical trials were done, and the outcomes have been positive, meaning simply that if you detect early, the outcome is going to be good. In stage one, imagine breast cancer stage one, the success rate, the cure rate is more than 90%. And in a stage four or a stage three, the success rate drops dramatically depending upon the subtype to less than 20%. So, detection early means that you don't need extensive treatment, your resources are not stretched, and the outcomes are good. You may need lesser surgery, lesser mutilating surgery. You may not need every modality of treatment. Maybe chemo is not required, and only surgery and radiation and hormonal therapies are required. I'm only giving an example of breast cancer. And similarly, these examples would straddle across all the cancers. So early detection means lesser treatment, lesser resources, and better outcomes. So the treatment modalities which have made a difference is first and foremost the biology of the disease and our understanding about the biology of the disease. The human genome, which was mapped almost about 2 decades back, helped us understand the genetic abnormalities which lead to cancers and which can be harnessed to develop medications. And then that's what has happened over the last 20 years. So our understanding has grown, and based on that understanding, the abnormalities which happen in the cancerous tissue has given us an opportunity to develop targeted drugs. And these targeted drugs are more specific. They pick up the cancer cells more as compared to the normal cells. So therefore, the success is high and the side effects or the collateral damage on the normal tissues is lower. So that's one advancement. That is falls under the umbrella of the targeted therapies, the immunotherapies, and other therapies of these similar nature. The other advances have been in the diagnostics, and diagnostics have been based on these genetic abnormalities. Number one, radiology, PET scans, newer generation of PET scans. In the other therapeutic modalities which are involved in treatment of cancer, our surgeries have become more precise with the robotics, lesser surgery, quicker recovery time, and better outcomes in terms of the functionality, one going back to normal lifestyle within a shorter period of time, the radiation becoming much better, more precise, and different types of radiations like the proton beams and the cyber knife, they've made treatments more precise. This precision actually leads to what is called as the advent of the personalized and precision medicine combined together. We are targeting tumors more precisely and not damaging the normal tissues as we were doing with the earlier therapies. Though chemotherapies are still used because the newer therapies still need to work alongside chemotherapy, but the overall results have gotten better with the combination of these two.
If you found this video helpful, don't forget to give it a thumbs up and share it with your friends and leave your thoughts in the comments below. And of course, subscribe for more content on health and lifestyle.